So today we're going to talk to Professor Ashkan, who's one of our consultant neurosurgeons at King's College Hospital, and he's going to talk to us about research and clinical trials.
Many thanks, Ellie. Hello, everybody. I think probably in no other branch of medicine, research and trials are as important as they are in the field of brain tumors and neuro-oncology. You may ask why. It's because despite all the advances that have happened in the past few years, still we are not doing as well as we want to with patients with brain tumors. So there's still a lot of room to develop and a lot of room to make what we do better. And that can only be achieved by doing research and by doing trials. That is why, in my mind, it is really crucial to essentially have, if possible, all the patients that go to the service at least in one of our studies and trials, because that's the only way that we can learn about this terrible disease, and that's the only way that we can help our patients, both our current patients and also moving forward those patients in the future. So we've been very lucky at King's to be, as they call it, quite research active. So we participate in a lot of national and international trials, and we also do a lot of our own in-house research. And that is really good for our patients, because by doing so, we are able to bring in the cutting edge research. Because remember, when we do trials, these trials involve novel treatments and therapies. And if you're part of those trials, that means that we have access to this experimental form of treatment well ahead and before they become mainstream. That is true. The reason these are experimental and research-based, it is because we're still investigating the efficacy and how they're going to help patients, but it's really only by doing research that we can learn. So we've been quite lucky, a lot of national trials. For example, as I'm speaking to you today, we are involved in studies with different types of tumors, from high-grade gliomas to low-grade gliomas, to metastases, to meningiomas. We also do quite a lot of in-house research trying to understand the basis of tumors. What is the genetics, innate genetical variations within tumors? What are those particular markers in the tumor that we can use to predict response to tumor or target new therapies for the tumors? But research is not all about looking at treatments. There's also quite a lot of research that we do which are to do with other aspects, because at the end of the day, for example, quality of life is paramount to our patients, and therefore the same amount of time we spend trying to look for new and novel therapies, we ought to spend in trying to making sure our therapies are safe, have got as little side effects for the patients, and also look to see what is important to our patients, so communication with our patients, to understand their needs, to understand what they see, the issues, the treatment, and then the other issues that might impact the quality of life. So it's very important to do, if you like, qualitative research, looking at quality of life, as well as much as it is important to look at, if you like, molecular characteristic of the tumors, or looking for new and novel therapies.
So lots of patients ask us about clinical trials, but what we just were going to talk about, and wonder if Prof Ashkan could help us answer today, is what are some of the barriers to clinical trials?
Thank you, Ellie. That's an excellent question. I mean, intuitively, you would have thought the biggest barrier is interest of patients to take part. And that is actually so not true. If your patients are given the opportunity to know what trials and studies are available, more often than not, they'll be very willing to participate. In fact, a lot of patients come to us and ask us about research and trials. So it's not the interest of patients at all. So this is very important to recognize that. I guess some of the barriers to trials are, for example, the knowledge amongst other clinicians to tell the patients about these trials. So obviously, unless patients know about this, we're not going to be able to recruit. So it's very important for all clinicians involved in the care of patients with brain tumor to be aware of what studies and trials are out there, so they can offer these to the patients at the right stage in the treatment. So some trials, for example, would recruit early on at first diagnosis, some would recruit at recurrence. So it's really important for clinicians to know about that. Another barrier to trials, for example, could be the logistics of setting up trials. Again, we've been quite lucky at King's. We've got an excellent research and innovation department who is very willing to help us set up trials. So, unlike many other centers, we've been quite lucky in terms of being able to facilitate the trials and get them through. Another barrier, for example, could be funding, and that is so important that the funding bodies out there understand the importance of brain tumor research. So at the end of the day, brain tumors are rare, only 1 or 2% of all adult tumors. So intuitively, you would have thought that the amount of funding that goes towards this kind of research is also limited. So it is our job as clinicians to, if you like, champion the needs of our patients to the funding bodies and say, yes, true, these are rare tumors, but the impact on the patients and the family and the society is really quite massive, disproportionate to the actual numbers. It's not all about quantities, the qualities, the impact of this disease on the patients, the families and the society. So we need to make sure they realize, and I guess Brain Tumor Awareness Month is one means of trying to champion the needs of our patients. So those funding bodies realize charity